protocol. That was message number one. Message number two, which I thought was interesting, is it's not Arizona, it's the greater Phoenix area where you see the flare-ups. It's not Texas, it's Austin, Texas. It's not California, it's LA. So this is where you have your new hotspots, your flare-ups, where you have dramatically higher infection rates. So it's not statewide, it's those particular areas. They pointed out to me, they pointed out to all of us that, for example, in many of these places, you'll see an infection rate of 50%. So if you look at the 10% for the state, that's misleading. In those particular counties, you'll have infection rates of 40, 50, 60%. And that's a reminder that it's now they're finding it's not just older people as they're testing a broader population. It's those 18 to 35 that you've seen a big spike up in terms of infections. And obviously those people who are infected, they're asymptomatic in many cases. They're younger, so they're not suffering complications, less likely to go to the hospital, certainly much, much less likely to suffer complications or fatality, but still infectious. So when you look at that map of the United States, you see the red there, you remind yourselves what the risks are as because many of those were in yellow or even green not that long ago. We're in a region, along with New York and New Jersey. Massachusetts is just right behind us. So it's a region where we feel very confident the infection rates are down below 3%. And that's why when we slowly open up our economy and allow our hotels to come, we're focusing on our immediate region because that is so much safer. The next chart is, again, you see the upswing in new cases nationwide. And we were talking to all the governors today on the conference call, and they had some indications. Texas, which is, they opened pretty early. They opened their bars. They said people aren't taking the protocols as seriously as they should, especially in the bars. We have not opened up our bars, but so in Texas, they've had to close down those bars and cite them where they're not taking the social distancing as seriously as they should. You probably saw we had a big outdoor bar gathering in New Haven over this past weekend, over 1,000 people out there, and that bar had to be closed down as well. So nobody's blameless here, but it's really important, as I hear from places like Texas, why we take this as seriously as we do. Ole Miss, Mississippi came in and they said, well, another reason you're seeing is we got young people coming back to campus, and many of those, mainly the athletes at this point, are testing higher in terms of positivity as well. Arizona, again, Doug Ducey, our friend the governor there, just said we got to hold our businesses accountable. They've been open for a while, and people are relaxing their guard, and that's what we can't allow to happen. So as I look at these states, talking to Governor Cuomo again today, talking to our regional governors, you've got states with a positivity rate 10, 15%. And as I told you, in Palm Beach in Florida, or Miami in Florida, or Phoenix in Arizona, or Austin in Texas, really selectively, the infection rate's a lot higher. And we are talking about some sort of a regional quarantine. If these folks want to come to the New York metropolitan area, the Boston metropolitan area, perhaps they should show that they've been tested in the very recent past, or they should quarantine. We're going to have some guidance on that very, very soon. Overall, I was sort of interested, Vice President Pence pointed out that we have over 3,000 counties in our country. A little over 100 of them are where all this flare-up is taking place. It just reminds you how concentrated they are and how we have to do everything we can to limit the spread once that concentration flares up. And that's why we get back to the basics, which is the next chart. And it just reminds you of the little things we got to do. Indoors, outdoors, bars, casinos. The most important thing is wearing the mask. We did a video this past weekend reminding people that the Apple stores in Florida and Texas and Arizona are closing down while they were opening up in Connecticut. And they're opening up in part because people are taking the distancing seriously. They're washing their hands on a regular basis. They're following the guidelines. And look, I appreciate it's really warm, it's hot, it's getting tougher and tougher to do. I feel fine. These numbers look like they're trending in the right direction. Maybe I can relax. This is no time to relax. Next chart is testing. I was, whatever you maybe heard this weekend about we're doing too much testing, ignore that. I think you heard from Dr. Fauci and Vice President Pence and Dr. Birx. There's nothing more important than what we're doing right now. If you have symptoms, get tested immediately. If you live in one of our cities in a more congested area, get tested monthly, no matter what, no questions asked, no cost. We're testing broadly right now in all of our high-risk facilities. We've tested everybody at the nursing homes, increasingly at our correctional facilities. Remind everybody it's free if you're in any of these categories. And I want you to know that we have now 138 testing sites spread all over the state of Connecticut. Go to 211ct.org. Put in your address. We'll show you where the closest testing facility is, where you can go there, no cost, take care of it. And finally, we're beginning to build out on our contact tracing as well. And again, talking to all of our fellow governors, we want it to go faster, and all the different states are finding that people are a little bit casual about perhaps answering their phone or responding to the text. So one of the things we've done, I guess there's a lot of spam, people don't know, so we've said CT COVID trace. That's what your text is going to show. That's what's going to show up on your cell phone. If you see that, take it seriously. You're not only keeping yourself safe, but you're keeping your family safe, you're keeping your community, your neighbors safe. Give us an opportunity to call them or contact them and tell them that it's time for them to get tested at no cost, time for them to self-quarantine if they don't want to get tested. That's how we're going to keep down, the spread of COVID. And this is how we make sure we stay in the green category and not in the red category, which you see is enveloping much of the rest of our country. I think with that, I'll leave it and see what other questions we have. And again, Josh and Paul are here, so let's go at it.
Channel 3 Eyewitness News.
Yes, Governor, you kind of touched upon this at the beginning. It has been 22 days since the large protests. It's been 22 days since the casinos reopened. And at the time, many were pointing to those events as a potential source of a possible resurgence. But now, 22 days later, we're really not seeing a lot of health consequences from those things. Why?
The question is why? I think you're right. And even in those areas where you see the infection rates going up, people are not necessarily pointing to, the protests, for example. I think what we're finding is wearing of the mask is probably the biggest determinant in terms of what you see in terms of the infection rate. More than protests, more than going to the casinos. And I'm really thankful, by the way, to the tribes. I understand it. We've had a number of people at the casinos. People are taking the distancing seriously there, and thank you for that. It does make a difference.
News 8.
Good afternoon, everyone. Governor, you had talked a little bit about speaking with some of the other governors and a possible quarantine, guidelines for people coming from Florida. And obviously, there's going to be a lot of Connecticut residents, maybe just returning, that spend time there in the winter. How quickly do you think that may be put into place? Whereas there might be a 14-day quarantine for those coming into Connecticut or returning to Connecticut from Florida.
Well, I know I'll ask Paul to answer this because he's been on the phone with all the chiefs of staff. We've been working on this for well over a week now. We're monitoring those numbers as you see the infection rates go up, and we're trying to figure out how we implement that together. Paul?
Yeah, thanks, Governor. As the Governor stated, we've been working on these conversations with our regional partners, particularly New York and New Jersey, continuing with further conversations happening today. I would just also say that it's not just a focus on Florida. Let's just understand that We are seeing the infections rate, as the governor showed in that map that is read, in various places all across our country. And we want to make sure that this state remains, our infection rate stays down based upon the great work we've been doing here. We want to make sure everyone stays safe. So I would say in the coming days we'll have more details on potential partnership between Connecticut, New York, and New Jersey as it deals with the 14-day self-quarantine of individuals who are coming from those states.
Thank you.
News 12 Connecticut.
Hi, Governor. I want to ask you about fireworks real quick, because we've been getting tons of complaints from people about fireworks going off at all hours of the night till 3, 4 in the morning, especially in the cities like New Haven and Bridgeport. Is there any thought of some sort of executive order to ban fireworks or curb them? I mean, is there anything that your office can do to make that situation better?
I don't think we thought about anything that extreme. I know our police are monitoring this very carefully. I'd like to think that come this July 4th weekend, we'll have that behind us. But I've noticed this too. July 4th is a holiday reserved for fireworks. What's going on the 2 weeks beforehand? Do you know anything more on that, either of you guys?
Yeah, no, I think the only thing I would add is that there are various fireworks that are being used in our cities that are illegal. And I want to thank the work of the various local police departments who have been monitoring it closely. I know that we saw a most recent report of a young child in Hartford who was injured by these fireworks that were illegal. But as the governor stated, we will be monitoring this closely, but we very much appreciate the work of the local municipalities and the police force in monitoring the situation.
And just one more question. Your rent relief, especially when it comes to the freeze on evictions, ends next week, July 1st. A lot of folks still say that they're having trouble paying their rent. Is there any thought about extending that, or are you thinking that July 1st the courts are going to reopen and start taking those claims?
No, we're taking a look at that, and we also are going to be adding some rent relief provisions to help people out. I understand, especially those that didn't get the unemployment, compensation. They're in a stretched position. Maybe they had to put off paying rent for a period of time. So we're going to be there to provide some assistance, not forever, but for the near term, just to help them get through. I do worry that July 31st, and when a lot of the aid and support that's coming from the federal government, including and the state of Connecticut, starts drawing to a close, people are going to potentially be hitting a wall, and we're going to do what we can to help them when it comes to rent relief.
But specifically on the evictions, obviously, Craig Fishbein and 2 other lawmakers are suing over that, trying to get the evictions to start immediately. Are you thinking that the evictions will be allowed to go forward starting July 1st?
We're taking a look at that right now.
Fox 61.
Hi there, good afternoon. We had a viewer question for you, Governor, and the question was, the person was at the beaches, our state beaches this weekend, and said that they saw a lot of people with out-of-state plates, particularly from Massachusetts. Would you consider limiting our state beaches to only Connecticut residents, seeing that we're diminishing our capacity at those beaches already?
Yeah, I think we would. I mean, I thought we were able to charge a differential for parking. Maybe that's something that's in the plans right now. Their beaches are open, by the way. They got very nice beaches, probably better. We've had to close down our beaches in midday or soon thereafter just because of overcrowding. So I think it is better for everybody to stay closer to home.
So you would consider just banning out-of-state people from the park?
I'm not sure that's legal, but I know that we can charge for parking, and that's what we're looking at.
And my second question, we've been receiving this one a lot, too, from some of our viewers. It's kind of 2-part. One, with everybody going back to work, employers are saying, hey, I'm getting employees now that say that they can make more on unemployment with the $600 federal addition to that than I would going back to work. So they're seeing some employees refuse to come back to work there. On the other hand, we have other employees who say, hey, I'm over 65, I'm compromised, I don't feel comfortable going back to work. what is your guidance on people going back to work in those two instances?
If you're over 65 and you're compromised, do not go back to work. If you can't telecommute, we've got a provision in one of our executive orders that provides, unemployment compensation for you. And you're right, I do support giving more federal incentives to give people the incentive to get back to work sooner. We're going to follow that. We'll track it probably closely to the unemployment rate, which right now is pretty high. So I support those type of incentives, something we're looking at here at the state level as well.
NBC Connecticut.
Good afternoon. Governor, what are your thoughts on how Phase 2 has gone so far, and are there any plans or any consideration to move up Phase 3?
I think we take a pause right now. I'm looking around what's going on in the rest of the country. I think Phase 1, 2, June 17th, so far I'd say so good. I don't think our reopening has contributed at all to any type of a flare-up that I've seen. And in fact, just the opposite. The metrics keep going in the right direction. But nor am I in a great rush to take the next level. Let's just give it a couple of weeks. That was always what we thought was going to be our plan, and we'll give more guidance within a couple of weeks.
And then regarding this regional quarantine, are we expecting a list of states where people coming from those states would be required to have a quarantine or a test, or is it just particular states that have higher positivity numbers?
Yeah, I think you tie it to the higher positivity numbers. I don't think you pick on a state, but obviously you're at some risk if there's planes coming from Phoenix or Miami or Austin, and where you have a very high positivity rate, even amongst younger people who can be asymptomatic. So I think in those categories, you would like see those people tested or self-quarantine when they get here. I think that'd be safer for the entire region.
And my last question regarding contact tracing, is the state just saying people reluctant to take part, or is it just they're not answering their phones? I know in New York there was an article a few days ago about people just refusing to take part. Are we seeing that here?
Yeah. What are you seeing there, Josh?
Yeah, we have seen some of that and heard some of that. So and that's common, across the nation for this type of activity. Contact tracing has been going on for 100 years, and this is the challenge our public health departments always have, is getting people to participate. So we're trying to make it as easy as possible, as the governor said. In particular, having this new telephony system with a consistent caller ID, and reminding people about what contact tracing is for. It's just to provide that type of public health guidance to help identify your close contacts, keep them safe, keep your family safe, keep your community safe, but equally to be on the lookout for the scams that are out there. So we just want to make sure it's clear that if you get that CT COVID trace caller ID, please answer the phone or answer the text message, and that's how we help keep these rates low in Connecticut.
The Associated Press.
Good afternoon, everyone. I just wanted to follow back up on the regional testing or the quarantine idea. How would it work? Would you be, how would you enforce it? Would you be warning people when they land at Bradley, when they drive into the state from 95? I mean, what are you envisioning?
I'm envisioning the fact that most folks come in from Newark, Kennedy, LaGuardia, Logan, and Bradley Airport, and that people are noticed that when they fly into one of those places from any of those highly infected locales, they're required to either self-quarantine and or better show that you've been tested. I think the idea of self-quarantining for 2 weeks maybe is tough, especially if they're coming up for a shorter period of time. I see this in Maine and some other states where they're just requiring the testing coming up. I think it makes good sense.
Is it just going to be those 3 states, or are you looking at doing this with Rhode Island and Mass as well?
I think Paul has talked mainly to New York and New Jersey. I talked to Governor Cuomo today. I'll be reaching out to the other governors as well in this region. We've done so much work together, and obviously if we had a flare-up in New London, that impacts Providence right next door. So we have a real incentive to work on this together.
Yeah, and I'll add that Massachusetts, since about March 28th, has had a traveler's notice. So for all travelers arriving to Massachusetts are instructed to self-quarantine for 14 days. So Massachusetts has been having something similar to this fact that's not dependent upon infection rate or COVID-related activities in other states, but just had it nationwide.
And also, I understand the governor of Nevada today on the call with Vice President Pence expressed some concerns about the president's comments slowing down testing. And I wondered, are you concerned at all about people maybe getting complacent about testing? I know you wanted about 100,000 tests a week, and I think last week was around 46,000.
Yes, Sue, I am worried about people getting complacent. I didn't think that message about we've got whatever came out of that rally was not particularly helpful. That's why Vice President Pence's task force was very clear today on how they're going to continue to accelerate testing and ramping it up, and there were a couple of comments about that, yes.
Thank you.
WTIC 1080 News.
Hi, Mr. Governor. Dr. Gifford earlier today said that you might be able to clear more family visitation at nursing homes. Is that something we might see soon?
Yeah, I think she has put out some guidance on that, and I believe that's happening already, isn't it, Josh?
Yes.
He said yes.
All right. Well, let's solve that one. Thanks.
The Hartford Courant.
Hi, Governor. I wanted to ask about crowds for a second because you mentioned the outdoor bar in New Haven that was shut down. We also saw that Stafford Motor Speedway is going to reopen this weekend, potentially with 2,500 people in the stands. Just wondering if you could explain what the latest thinking is on outdoor crowds and why, the bar is shut down and then you have potentially a large crowd at a speedway.
Well, first of all, outside, inside, drinking, no masks, everybody letting it rip is pretty dangerous in terms of COVID infections. I heard that loud and clear from our friends in Texas when they wanted to know what was resulting in the surge they had going on there. I mentioned they had to actually close down some of the bars, which they had opened in that state. We have not opened them here. What was going on here was, illegal at this point. The Speedway, I think we've got them at a 25% capacity. There's plenty of room for social distancing. So if you can keep your space, we wanted to cautiously let people get back and let the Speedway get going again.
Mm-hmm. I also want to ask about Metro North because we understand ridership is significantly down. What is your view on the short-term and long-term future of Metro North? Do you see long-term impacts on ridership with employees working from home and people still kind of tepid about going to the city?
Yeah, that's a really good question. I mean, at the peak of the pandemic, ridership on Metro North was down 95%. And Joe Giletti's told me we're still down 85%. So we're still down dramatically. And maybe that's a public health concern I'm not sure about being in a train right now, even though they've got some real protocols in place to keep it clean. Maybe people are driving a little more often. My hunch is people are going into the city a lot less often, even though they've now begun opening in New York City over the last few days. So I think it's going to take another 30 days to see what the trend line is. But my instinct is you're going to find a lot less back and forth between New York City because people realize telecommuting was working pretty well. I don't have to spend 2.5 hours a day getting to and from.
Mm-hmm. Thank you.
Hearst, Connecticut Media.
Thanks, Max. Sorry, it took me a while to get my little mute thing off. Governor, do you regret not having more teeth? And you've asked for so much voluntary compliance, and then you get a case like this, the 1,000 people showing up. There was some tension at the bar today. So do you regret not having tougher rules?
I don't, Ken. We were asking people to do things way out of the ordinary when we're, shutting things down and wearing the mask and keeping your distance. And I could have been slapping fines and being heavy-handed, but that was not the way we did it, nor do I think was the way we had to do it. I think at the end of the day, People were self-policing themselves, talking to their neighbors if they thought there was something that needed to be done. There's no question about it. There's people are feeling a little edgier right now. You saw what happened at that one particular bar situation. They were closed down. I think that was appropriate. In Texas, they're being closed down for 30 days if they don't follow the protocols. But so far, I think we don't have to have a heavy hand here. People are taking care of it themselves, with some notable exceptions.
And that, I guess the follow-up is, are there any state or municipal shutdowns or sanctions against businesses for COVID safety above and beyond this place in New Haven?
Not that I've heard of. I can tell you that we've been noticed on a fair number of places where they're not willfully violating the rules, but let's say they're casual. The cashier's not wearing. People in there are not wearing the mask. And if they want us to, we go in and we give folks a strong reminder that this is the guidance, these are the rules, this is the law in the state of Connecticut, and follow the protocols.
I'll also add, this is a great opportunity to highlight all the great work that people of Connecticut have done to adhere to the guidelines. I know the governor was at the Apple Store and talked about how the Apple stores are closing across the country, but not here in Connecticut. I know I was out and about this weekend and out in the Manchester area, in the Manchester South Windsor area, and seeing the signs in all of the various retailers saying that they're Connecticut COVID approved, really providing confidence to the customers and the workers of those facilities. I've been seeing those signs all across Connecticut. I know we've gone through, and you can look up and see all of the entities that are self-certified under our website. So I think people of Connecticut, the businesses of Connecticut, have really stepped up, and it shows overall in our COVID response and in our COVID data and our numbers.
And finally, Governor, you're an old retail politician. You got any guidance for political candidates who are going to start their campaigns and put in some sneaker time on sidewalks and knocking on doors? Get a variety of masks, perhaps?
I would, I think telephone is often a pretty effective way to talk to people. We've all discovered Zoom and prioritize that. I'd be, a little more cautious about knocking on doors. If you knock on doors, or wear a mask.
Thanks, Governor.
Connecticut Mirror.
Hi, Governor. Do you have any thoughts at this point as to how you intend to manage the pandemic after September 9th when the public emergency expires?
Yeah, we're going to be, talking to the legislature and get a better idea of which of the executive orders they'd like to continue. Because most of them are related to deregulation, so there might be some incentive to keep some of them going. I think we can only do that, with their help. And beyond that, Paz, let's get a better idea of where we are in September. I mean, my strong hope is that our downward trajectory on infections and positivity continues, and there won't be any need to continue the executive orders.
But so that sounds like you're leaving open the possibility of potentially asking the General Assembly 2 months before their election to take some action to either give you the power to continue restrictions or to have them do so. Do you have any concerns that this would become politicized if you do it then?
Well, they gave me some emergency powers that allowed us to work very quickly back when the pandemic was crashing on us, and we worked very quickly, had to make a lot of real-time judgments. Sometime September, October, I think people will finally, I believe, say we made the judgments we made. Lamont no longer needs the emergency powers. And at that point, Paz, people have a chance to say, boy, I wish he had opened a lot faster, or I don't think he ever should have shut down, or whatever the debates may be. Everything gets politicized in this world, but I think we're on track to, no longer have the emergency powers come September.
Thank you.
CT News Junkie.
Good afternoon. So I'm going to ask a question that I haven't asked in a while. I'm going to ask about how we're doing on PPE.
Wow. You're right about that, and it's good that you didn't have to ask that question because, As we've talked about before, Christine, supply and demand have come more into balance. And I think Josh pointed out to me that we're maybe the surgical masks were going at, say, $7 just a few months ago. Now we're at less than $1. It gives you an idea of how the markets work, not always on a most timely basis. I think what we've got to do, and what Josh has taken the lead on, is not sitting around waiting to hope that Washington is going to have a real stockpile if we have another flare-up. The Connecticut has its own stockpile. We're ready to go if something else happens this fall.
Were there any orders that we did not get, any large orders that did not come through or fell through?
Yeah, there were. I mean, we canceled some, several months ago when it turned out some of the suppliers we've been talking to were not going to be able to fulfill their orders. We didn't lose any funds. There was we weren't victims of fraud as many other states and municipalities were. But we did cancel some orders that were flaking out on us. But overall, as the governor said, we've since this began acquired over 55 million units of PPE. We have a inventory of over 10 million units of PPE currently, and we are planning, as the governor alluded to have a reserve in addition to the ongoing needs of our state agencies and some of the nursing homes and nonprofits that we help support through mutual aid. That need continues as we have COVID in many of these facilities still, and we need to be careful, but we do want to build our own reserve so that we're not at the mercy of the federal government or anyone else if we do have a second wave.
And my other question is, Governor Cuomo ended his press briefings on Friday. Are you thinking of ending these briefings anytime soon?
We certainly are scaling them back. Christine, 3 months ago, every day COVID was breaking, the world was changing, and I really felt an obligation to give people the best real-time information on what we were doing, why we were doing it, and what they can expect. I think today you've probably seen that these daily summaries have a certain consistency to them, so we don't need to do this on a daily basis. But I think we'll still continue to do it on a somewhat regular basis, a couple times a week, just because there's so much else happening around the country that can impact Connecticut. And I think people are curious to know how we're going to respond to that.
Thank you.
Connecticut Public Media.
Good afternoon. Has the state revised day camp guidelines, that is, to permit groups from 10 to 14? And is there any mandate to check a child's temperature when they walk into camp in the morning?
Do you know the specifics of that, Josh?
No, our teams are continuously working with our public health department on the latest guidance. The CDC guidance is constantly changing on many topics, including this, but we'll continue to publish guidance through our early childhood group as necessary.
The Waterbury Republican American.
Thanks very much. I'd like to just follow up quick on Sue Haig's question about quarantine. Are the 3 states or other states involved in these discussions talking about having an exemption or an exception for individuals who can document that they have been tested and tested negative? And if so, how, what's the window? Is it I was tested 2 weeks ago and I'm negative, or I was tested 2 days ago and I'm negative?
Yes, if you can show that you've been tested in the very recent past, say 3 or 4 days, I would guess, but let me talk to my fellow governors about it. Then you can come up here, you can get to work or vacation or whatever you want to do. If you cannot show that you've been so tested, then you are going to have to quarantine. That's what my recommendation is to our fellow governors from those COVID-infected states.
Yeah, okay. And in terms of contact tracing, are we still below 50%?
Yeah, we don't have the final numbers from last week yet. We'll get that by the end of the day today, but I'm optimistic that we'll have been above 50% for last week. And,
are you guys planning some sort of public relations campaign similar to the mask? I thought you might have mentioned that earlier, but I'm not quite sure.
We are planning to increase the amount of PSAs and other media that we're doing related to contact tracing, but also to testing generally, the importance of testing, particularly targeting communities where we know the risk is higher, that have been more adversely impacted. And our communications team is working on a number of strategies there.
Okay. And one question on visitation at group homes operated or funded by the Department of Developmental Services. What's happening with that? Commissioner Griffin was on the DSS commissioner told the Appropriations Committee today that DDS was working with DPH on a plan. I looked on the DDS website. They seem to have some sort of plan. I'm not quite sure what's happening there.
Yeah, I'm not quite sure.
Deirdre Gifford, I know, issued some guidance and protocols for nursing homes and other congregate facilities. As you know, Paul, we were very strict about not letting outsiders in early on for a fear about the possibility of bringing the germ in with them or taking it out. I think that because of the lower positivity rate in the nursing homes, we're finding that we can test people coming in and let them see a loved one. I think it's time to do that. Some of it may be regarded, you can do outside where it's a lot safer, but I think most of our nursing homes are now opening the doors on a restricted basis.
What about the group homes for the developmentally disabled? I guess is what I'm asking now.
Yeah, I know Commissioner Sheff is working on similar plans to ensure the access to group homes and other congregate facilities as well.
Okay, thank you very much.
All right, I think that's a wrap for today. I think we should feel good about where we are as a state when it comes to what's happened in COVID over the last 60 days. We've continued to make consistent progress. I feel proud of where we are, not just the state, but our region as we work together collectively on this. I see much lower positivity rates trending in the right direction. That's not true about the rest of the country. Don't take it for granted, but thanks for everything you're doing.